If you feel like your butt has suddenly disappeared after pregnancy, you're not alone, but try some of these tests and exercises. So first you're gonna lie face down and you're putting your fingers on your hamstring. When you do that, you wanna squeeze your glute and make sure that the hamstring stays soft and squishy as you're tightening up your bottom. And then what you're gonna do is try and lift your leg. You wanna make sure that the glute is staying nice and firm as you lift your leg. Next up, we're going to do a hip hinge and we're going to use the wall to help us out. So stand about half a foot to a foot away from the wall with your back to the wall. Keeping your big toes on the ground, you want to reach your hips back to touch the wall. This is really good to help with moving the femur back in the socket, releasing the back pelvic floor tightness, and especially if you find yourself clenching your bottom throughout the day. As you do this, you want to feel your glutes lengthen and your pants stretch as you sit back into your hips. Next up is a wall press, and this is great for working your glutes without your quads. So you're going to lay on your side with your feet on the wall and keep your bottom side abs slightly lifted to help stabilize the pelvis. You're going to use your top leg to press into the wall, and you're pressing with a good tripod foot. Don't press yourself into an anterior pelvic tilt. You want to keep it nice and stable. Think about extending from your hip rather than your knee. You want to use your glutes more than your quads. Last but not least is one of my favorite exercises to help loosen up the back of the hip and the back of the pelvic floor, which just helps the glutes work a little bit better. So you're laying on your side near a wall with both feet on the wall and your knees at a 90-degree angle. You can use something like a foam roller, a towel, or a yoga block and put this in between your feet and your knees. Then using your abs, you want to lift your bottom side ribs up from the table and you want to keep this space the entire exercise. Then inhale into your back and sides. As you exhale, press your top knee down, squeezing the towel and feeling your top adductors engage. While you're still pushing down into the towel, gently pull your femur back into your hip socket. You should feel a little bit more tension in your adductor, and you don't want to feel your feet pushing into the wall. Shift your knee back to the starting position and then work on pulling it back again. After going through these tests and exercises, try some of your regular glute exercises or things that your hips may have felt tight with and see if you notice a difference.